So when we had a clinic and had too many patients in there, not enough people, we would just put people on the inversion table and tell them to hang for a little bit until it was their turn. Some people choose to use this for back pain relief. Mostly people use it for back pain. I think that's the reason why. Right, Andrew?
Sure.
Back pain. Honestly, we used to use this. I used to. Now we don't really promote it too much anymore. So this is one hell of a video on how to use an inversion table right now. So we don't use it too much anymore or at all, really, because it's temporary relief. It's just you're better off spending the time upside down into fixing your shit rather than just getting relief, because relief just comes and goes. But it's not going to hurt you if you do it right, unless you leave yourself like this and can't get out, and then they find your skeleton months later like Will. All right, so inversion table. How to use it? Well, you don't want to start by flipping yourself completely upside down because it's a lot at first. People can get lightheaded, dizzy, then make symptoms a little worse. So there's little clips on here. Start off at about a 40-degree angle. So get your height on inversion table. Use your arms to get you down there, like this. About 40 degrees. That's a good place to start. It's kind of light like that. So what is occurring right here is because you all day, you have whatever, let's say you're using this for your back right here, and you weigh 100 pounds or whatever it is, 800 kilos, whatever it is. You have that much weight. It's like having a dumbbell on your head. Now, bam, it's causing compression on your body because gravity pushes you down to earth, and it's also going to compress your joints. And if your body's out of position for too long with that compression and the way you move, you can start wearing stuff down. The inversion table feels good temporarily because it's reversing that. All that weight that pushes you down, at least maybe half of it here, is now pulling this direction. Your ankles are connected, so what it's causing is traction to the joints. It's separating joints. It can separate discs. It can temporarily, if there's any herniations or bulges, it can pull them back in, retract them, and feel pretty good. But like anything in life, if you're just passive laying there flaccid, you're not doing anything to fix your problem. So if you are going to be on inversion or use one, learn to be active on this thing. Here's what that means. If you're on this for disc herniation, right now, if you're not active, it's just flipping you into forward tilt. Notice there's this big arch in the back from this. The ribs are popping up. And this anterior tilt is actually an ineffective position to properly traction your joints. So what to do right here? So first step when you're on an inversion table is to learn to pull the ribs down a little bit just like that. Okay? You can pull the ribs down. It's going to put your spine in a little bit more of a neutral position. You can focus now on arching. Go for a full arch. Good. Go for a full tuck right now. Great, just like that. Arch tuck. You're actively moving your body under inversion. You may be able to explore and find some new ranges of motion that are currently painful when you stand, but you can find them when you're inverted, which is great because that can give you a goal to move forward when you're not upside down. Also side-to-side movement with this one. You can laterally tilt your hips without bending. Right, Andrew? Yeah, right.
I'm using my ankles.
Oh, you're using your ankles for this one? Right. So what he's doing here is he's really trying to drive the right ankle all the way this way towards me. And what this is doing, it's causing a lateral motion of the pelvis. And you may find this is going to increase some circulation, give you some pain relief, or allow you to explore those painful ranges of motion that are painful standing. You can explore them here. So those are some basic exercises doing the inversion. Yeah, we can do rotation like we did before. It's always a good one. Now, when you're rotating, the low back itself, it's not really rotating too much. The joints aren't designed to rotate in the low back. So you're really rotating throughout the middle back here with a tight core. So you can rotate side to side. That's good, Andrew. It's just, they get it. Okay, good. Now, coming up from inversion. Now, if you flip yourself upright, you could really tweak yourself because everything's relaxed. So when you come up, get yourself to a neutral position, maybe even right about there. And go back through those same motions again. Find that spot. Pelvic tilt, arch, middle. Andrew, quit screwing around. Serious.
Touching me.
Arch, tuck, arch, middle, side bend. Notice what you're doing is you're re-engaging your muscles now as gravity begins to enter the picture, which is right about there. So before you get up and go crazy and run, get in your freaking kids' flag football league and jump in there. Once again, pelvic tilt it again. Do something.
Got a tiger on your shirt.
It's awesome. It's Triumph's old motorcycle.
Do something.
Motorcycle. Yeah, pelvic tilts. Notice you're transitioning yourself to an upright position. I lost it, but I'm back with you. I love you guys. Notice I'm back. Okay, rebounded, just like you're supposed to do. You always.
Video?
What's that?
Is this a good video?
That's hard to say.
I think it's pretty good
You
so
guys
far.
think?
I'm enjoying myself.
You think you're enjoying yourself? So inversion, notice there's not much passion when I speak about
the
this.
inversion table.
That's what is lacking, the passion towards it. I'm like, how to use one? I'm like, you shouldn't use it, it doesn't matter.
But people have them and they just sit there, so if you want to use it. here's
They're
the
not,
thing to
if
do.
you do it right, you can get some benefit from it.
I
But,
haven't used one in like 4 years. So
Yeah.
This is my...
and Andrew herniated disc in his low back.
I tried to use it for that. It would feel good for like 5 minutes, and then I'd stand up and be like, oh, it doesn't feel good anymore.
Yeah. So that's why we don't recommend an inversion table. It's the end.
They're fun once, though.
They were fun to do that.
Yay!
Yeah, so thanks for watching, guys. Subscribe and
Is anyone still here?
follow and check out our program so you don't have to use this.
Do you think we're talking to anybody?
I don't know. I'm sure someone's watching. Like they accidentally left it on and it
Oh,
just
right.
shows a view.
Yeah. Yeah, or the thing's too far for them to stop. You know what I mean? How you just like, maybe the phone fell on the ground and they're on the bed, so they're just listening.
What the hell?
This
I can't
video,
find it.
it'll end, and then the YouTube will close. Maybe that happens. If for you that out there, thank you for not, putting effort to getting your phone. You're obviously not putting effort in to fix your shit. That's the case.
Bye.
Bye.